Hi everyone, I am Dr. Anisha, your microbiology faculty, and today we will be discussing about chemical agents of disinfection or sterilization. And under chemical agents or disinfection, we will be discussing about all the categories of agents, their working principles along with their uses. So firstly, we need to classify these chemical agents. And this classification, it is based upon their efficacy. And with efficacy, we mean how well these agents are able to act upon certain organisms. And these organisms can be bacteria, these can be viruses, these can be fungi. And most importantly, whether these agents are able to destroy bacterial spores or not, right? So firstly, let us discuss about the level of disinfectants. We have 4 categories, which include firstly low-level disinfectants. Then we have intermediate level disinfectants, high-level disinfectants, and lastly, chemical sterilants. So what are the differences of all these disinfectants and what is their spectrum of activity? So firstly, discussing about low-level disinfectants. So these disinfectants will be active against vegetative bacteria and enveloped viruses, whereas they will have variable activity against the fungi and will not have any activity against non-enveloped viruses, tubercle bacilli, as well as bacterial spores. So why are we considering that it is easier to destroy enveloped viruses over non-enveloped viruses? Because these enveloped viruses, these are made up of lipid envelope. The envelope, it is made up of lipid. And these agents are very easily able to disrupt the lipid component. The lipid gets dissolved and they are easily able to destroy such viruses. Whereas non-enveloped viruses, they do not have any lipid outermost layer. They are comprised of capsid, which are very difficult to destroy. And that is the major objective or major principle behind getting the enveloped viruses killed first or easier than non-enveloped viruses, right? So these low-level disinfectants have major activity against enveloped viruses as well as vegetative bacteria. Now moving on to intermediate level disinfectants. Now these disinfectants will have activity against all the important categories, but they will not be able to destroy bacterial spores. This is the difference between low and disinfectant. And now comes the category that is high level disinfectants, which may or may not have activity against bacterial spores. All the other categories, whether it is enveloped, non-enveloped viruses, the fungi, the tubercle bacilli, all of these will be disrupted by high-level disinfectants, but they might or might not have activity against bacterial spores. And the most important category, that is chemical sterilants, these are going to have an activity against all the pathogens. They'll be able to destroy, very easily able to destroy the spores as well, right? So now moving on to the broad categories of these disinfectants. So firstly, let us talk about alcohols. We will first be enlisting all of these agents and later on we'll be discussing about their working principles and uses. So firstly, when we talk about alcohols, we have 2 categories: ethyl alcohol and isopropyl alcohol. Then alcohols, they are classified under intermediate level disinfectants, right? And then we have the next category, which include the aldehydes. Now these aldehydes are formaldehyde, glutaraldehyde, and orthophthaldehyde. So how do you remember this if we are talking about the aldehydes? So one important mnemonic or one important principle that will help us identify or learn this is the mnemonic fog. Now, aldehydes have been used or they are in practice, or now that formaldehyde is obsolete now to be used for fogging or fumigation of OTs. So with aldehydes, can we remember this mnemonic fog? So F stands for formaldehyde, O stands for orthophthaldehyde, and G stands for glutaraldehyde. So aldehydes were used for fogging or fumigation in OTs, right? Now next category is phenols. So most of us might be aware that phenyl has been used or it is being practiced as a surface cleaning agent or surface disinfectant in most of our houses, right? So with phenols, can we remember phenyl? And what do these phenyl or surface agents include? These are Cresol, Lysol. Lysol, it is being used in our houses for cleaning the floors, right? So Lysol, Cresol, Chlor, xylenol, all of these agents, they come under phenols. Then we have the halogens. Now for halogens to remember, we will take the first letter H. So for H, we have the hospitals. And most of you must be knowing that in hospitals, we use a lot of iodine and chlorine, and the iodophores. So these conclude the agents which are included under halogens. And then we have oxidizing agent. Oxidizing agent, O. So of course these are going to have O in the agents as well. So it is hydrogen peroxide and peracetic acid. Then heavy metal salts include mercuric salts, silver agents, etc. For gases, we have very important agent, that is ethylene oxide. And for dyes, we have aniline dyes and acridine dyes. And the surface active agents include quaternary ammonial compounds, QAC, along with 𝗘𝗅HEXADINE. Now, importance of these agents will be discussed later, but firstly, let us broadly classify them as low or intermediate or high level agents. So, aldehydes, they will be coming under high level disinfectants, or these are also known as chemical sterilants. Now, these halogens will be classified under intermediate level of disinfectants, whereas the oxidizing agents, they will come under high level disinfectants. And then the surface active agents, they will be classified under low level disinfectants. will be classified under low-level disinfectants, and the ETO will be classified under high-level disinfectants. So these are the important categories and their spectrum of activity. Now moving on to the first category, that is the alcohols. Now alcohols, we have already discussed that we have two important agents that are ethyl alcohol and isopropyl alcohol. And their working principle is majorly dependent upon the denaturation of proteins, and they also dissolve the lipid components. Now these alcohol also have activity against certain enveloped viruses, and these important enveloped viruses, AIDS virus or HIV virus. So with A for alcohols and A for AIDS, we can remember that alcohols have activity against HIV virus as well. So what are the uses of these agents? Firstly, they can be used for hand rubs, where 70% ethyl alcohol is being used. Then they can also act as certain disinfectants for non-critical items like thermometers. So when a thermometer, we are talking about a thermometer, we have mercury as well, right? So with thermometer, can we remember the shape of the thermometer and the first letter of the alcohol, that is isopropyl alcohol. And how are we going to disinfect it? We are just going to dip the thermometer for around 10 to 15 minutes in isopropyl alcohol, and then we are able to achieve the disinfection. Then these alcohols can also be used to disinfect certain hospital setups or certain areas like hospital benches, lab counters, certain tubings, catheter hubs, etc. So now let's move on to the next category of disinfectants. We have aldehydes, which come under high-level disinfectants. Now these high-level disinfectants or the aldehydes, they have sporicidal activity as well. They are able to destroy spores. So when these are able to destroy spores, can we classify them under as chemical sterilants? Right? So we have already discussed the mnemonic fog for fogging, which was done earlier in OTs. So for F, we have formaldehyde. And with O, we have orthophthaldehyde. And with G, we have glutaraldehyde. So for G, let us remember a mnemonic that two siblings, they are glued to TV for 20 minutes. And that defines the duration of its activity and the percentage that we use. So we have 2. So most commonly it is available as 2%, which is also known as Sidex. Then it acts in around 10 to 20 minutes. Right? So when we talk about the working principle, the major principle lies on the denaturation of proteins. Alkylation of the components. And this working principle remains the same for all the 3 agents. Now let's talk about their uses. So formaldehyde, we have already discussed that it was initially used for fumigation. Then important use that most of us know that formalin has been used as a preservative of anatomical specimens. It is also used for embalming. Etc. And formaldehyde, it is also used to prepare toxoids from toxins. But the use of formaldehyde is obsolete now because it is very toxic. So it is also carcinogenic. See, we do not use formaldehyde now. So now we have orthophthaldehyde and glutaraldehyde. So we have already discussed that glutaraldehyde, it requires 10 to 20 minutes of contact time, right? And one important disadvantage of glutaraldehyde is that it has to be activated first. So it is present as inactive form, which needs to be activated first. And once activated, it remains active for around 14 days. So this gas or this compound is toxic also. It has pungent odor also. Right? So the major use of glutaraldehyde is for fumigation in OTs. Right? And this disadvantage has been overcome by orthophthaldehyde, which is present in a concentration of 0.55. And a major advantage over glutaraldehyde is that it does not require activation. It is less toxic, and it has a smaller duration of activity, or it requires just a smaller contact time of 5 to 7 minutes. Right? So all of these agents are high-level disinfectants along with the sporicidal activity. Now moving on to the next category, that is phenols. With phenols, we have already discussed. Let us learn it with the help of mnemonic phenyl or fluors. Right? So for phenols, we have Lysol, Cresol, chlorxylenol, chlorhexidine. Chlorhexidine, it is surface active agent. Now, the major principle of the activity of these phenols is the disruption of nucleic acid and proteins. And they are majorly used as surface disinfectants, but some agents in phenols are considered as or can be used as skin antiseptics. And what are these agents? We have chlorhexidine, which is the active component in Dettol, and chlorhexidine, which is the active ingredient or active component in Savlon, right? So these are the major uses of phenols, and one important use of 5% phenol is the disinfection of sputum, which is collected from the TB patients. So this is the most common disinfectant which is used as a solution for the treatment of sputum samples. It is used in TB lab. Now moving on to the next category, that is halogens. So for halogens, we have iodine, which is available as tincture of iodine and iodophore. What is tincture of iodine? It is just the preparation of iodine with potassium iodide. And iodophore, it is when iodine is combined with a carrier. And what is the carrier we are using? We are using povidone. So we say povidone iodine. Which is nothing but the betadine we use as skin antiseptic, right? So we have tincture of iodine and povidone iodine. So tincture of iodine, it stains the skin, and it also causes skin allergies. And this disadvantage of tincture of iodine has been overcome by iodophore, which does not stain the skin, no staining, and no allergies. So the major principle lies the same, that they are going to disrupt the cell components, they are going to dissolve the lipids, they are going to disrupt the nucleic acid and the proteins. And iodine, we have already discussed that these can be used as infectants. They can be used as mouthwashes. So what are the different percentages that we use for these different categories? So 1% of iodine, it is used for mouthwash. Then 5% it is used for wound cleaning, wound care or cleaning. Then 7.5% is used for hand scrub, and 10% of iodine it is used for surgical skin preparation. Right? So now talking about chlorine. Now chlorine, it is available as 3 states. One is free chlorine, which is used for municipal water treatments, swimming pools, and then we have sodium hypochlorite, and calcium hypochlorite. Calcium hypochlorite, it is the bleaching powder. And sodium hypochlorite, it is vastly used in hospital settings for disinfection. So when we talk about sodium hypochlorite, its major mechanism is that firstly, it needs to be diluted. It needs to be diluted for different activities. So what are these different uses of sodium hypochlorite? So it can be used for blood spill management. It can be used as a surface disinfectant. In microbiology labs, we use this as a solution where we put all the slides and all the bacteriological specimens inside first before leaving them or before taking them for autoclaving, right? Sodium hypochlorite can also be used as lab disinfectant. One major disadvantage that lies with sodium hypochlorite is that it needs to be freshly prepared daily. Freshly preparation is required. Fresh preparation. Then its activity somehow lowers down in presence of organic material. And for the mechanism, we have already discussed that it requires certain dilution, right? So what are these dilutions and how is the spill management done with sodium hypochlorite? So if it is a small blood spill, we require a dilution of 0.05%. We require a 0.05% concentration of sodium hypochlorite, which is 1:100 dilution or 500 ppm. Whereas for large blood spill, the concentration is 0.5%, that is 1:10 dilution or 5,000 ppm. And for liquid waste disposal, we require 1% of sodium hypochlorite, 1% concentration, which is 1:5 dilution, or it is 10,000 ppm. But majorly when we talk about spill management, we are talking about smaller and larger blood spills. Now moving on to the oxidizing agents, that is hydrogen peroxide and peracetic acid. So the major mechanism of action of hydrogen peroxide is that it is going to liberate free hydroxyl, which is going to be active against cell constituents, that includes the membranes, the lipids, DNA, etc. So hydrogen peroxide can be used as different concentrations, right? So when we talk about, say it is 3% H2O2, it can be used as surface disinfectant. Then if the concentration raises to 3 to 6%, then it can be used to disinfect ventilators, toner pens, other medical devices, tubings, etc. And when the concentration raises from 6 to 7.5%, then it can act as a chemical sterilant in plasma sterilization. And peracetic acid, this can be used as a disinfectant. This can be used as a disinfectant in automated machines, and what are the two important instruments which can be disinfected with peracetic acid? It is the endoscopes and arthroscopes. One important point when we are talking about scopes is the letter O, and with O we had orthophthaldehyde. And majorly when we talk about scopes, like endoscopes, cystoscopes, etc., we will talk about orthophthaldehyde, right? So peracetic acid is majorly used as sterilant or disinfectant in automated machines, and it can also be used for hemodialyzers when peracetic acid, it combines with H2O2, right? So now we have already discussed about the use of hydrogen peroxide in plasma sterilization. So the chemical sterilant which is used in plasma sterilization, it is hydrogen peroxide. So let us first discuss about the plasma sterilization. What does this exactly mean? So plasma, it is a gaseous state which comprises of free radicals, OH, O. Then we have photons, free electrons, etc. So plasma state is created in this type of sterilization. And what exactly are we doing in such procedure? That firstly in the machine, this is a plasma sterilization, a sterilizer machine. So in the machine, firstly vacuum is created. Vacuum is created, and how it is done? So the air present inside it is completely displaced and a vacuum state is created, and then the hydrogen peroxide, it is allowed to enter inside. So once this hydrogen peroxide enters, it is allowed to percolate inside the instrument, and it reaches all the spots which are present and all the materials which are needed to be sterilized. And after this hydrogen peroxide diffuses into the whole area, then electric field is passed. Electric field is allowed to pass. Now, what is the role of this electric field? Now, this is going to disrupt the hydrogen peroxide into hydroxyl and hydroperoxyl. Hydroxyl and hydroperoxyl group. And these agents are going to have the microbicidal activity. They are going to disrupt the important cell constituents. They are going to interfere with their activity. They are going to destroy the nucleic acid proteins, etc. So this is the active ingredient, that is the hydroxyl and hydroperoxyl, which are going to act against the organisms. And one important point is that a low temperature of 37 to 44 degrees is maintained throughout the cycle. So a very low temperature is maintained for plasma sterilization. And what is the sterilization control? So for plasma sterilization, we can remember the letter S, that is Bacillus stereothermophilus. So this is about plasma sterilization. It is one of the most important upcoming questions in your exams. So let us discuss a little bit about the heavy metal salts, which include the mercuric salts, copper salts, silver agents, so the major role of these salts are that they are going to combine with certain cell components of our body and metallic components, and then they are going to disrupt, right? So what are the silver components we are talking about? So it is silver sulfur diazine, which is used for burns. Then copper and mercuric salts, they are also acting as surface disinfectants, surface disinfectants. Then we had, earlier we used to use silver nitrate for ophthalmia neonatorum patients, which is now replaced with erythromycin and other antibiotics for the treatment, and this practice of using silver nitrate is obsolete now. Now moving on to the dyes, that is aniline dyes and acridine dyes. So for aniline dyes we have crystal violet, gentian violet, malachite green, etc. So what are the role of these dyes? These are, firstly, they're used, this crystal violet and gentian violet, these are used for staining purposes. And malachite green, these are also the active ingredient or coloring dyes, coloring agents or important agents which are used. Malachite green, it is used in LJ media, right? And acridine dyes include 𝗘𝗵𝗆, isoflavin. And all of these dyes, acridine and aniline dyes, they are active more against gram-positive bacteria than gram-negative bacteria, right? And then let us move on to the important category, that is gaseous sterilization or ethylene oxide gas. Now this is a chemical sterilant which is used very, very widely in hospital settings. So what is the working principle? So the working principle of this particular machine, it is based on the presence of certain conditions or preconditioning states which are required. For example, firstly, the air has to be completely removed and it has to be replaced by vacuum, one thing. Then before allowing the entry of ETO gas, we need to maintain a particular temperature, humidity, and a particular concentration of this ETO gas is also needs to be set at a particular point. So what are these preconditioning states? So temperature, if the cycle is running for around 1 hour, the temperature needs to be set at around 55 degrees. And if it is running for around 4 to 5 hours, then the temperature that we require, it is 38 degrees. Then for humidity, we require at least 40 to 80% of relative humidity. And the concentration of this ETO gas, it needs to be 700 mg per liter, right? So firstly, air, it is replaced completely by vacuum. Then these particular parameters are met, and then the ETO gas, it is allowed to enter inside and percolate, and it is used as a disinfectant. Now, one important disadvantage of this particular gas is that it requires last step, that is degassing. And what do we mean by degassing? We need to let this ETO gas out. We need to close up this machine for around 8 to 12 hours, extensive degassing of 8 to 12 hours is removed because this particular gas is very toxic, highly toxic, and before using the instruments or before using all the materials, we need to get rid of this toxic gas, right? So this is the sterilization condition we were talking about that we require to maintain all of these parameters. So ETO gas, it is going to combine with the cell constituents. It is going to cause alkylation. It is going to disrupt the DNAs, the proteins, etc. Right? So now, what are the important uses of ETO? So let's remember this mnemonic, Oh my heart. So with O, let's remember the sterilization control, that is Bacillus atrophis. And for the uses, the first important use or the first most common one-liner mnemonic that is used from ETO, it is the sterilization of heart-lung machine. And with the letter T, let us remember all the instruments or materials having T in them. So firstly, we have sutures, dental implants, then we have the catheters, then we have respirators, etc. So heart-lung machine, all the sutures, catheters, respirators, dental instruments, implants, these are all can be disinfected with the use of this ETO machine. So why is this ETO machine used? Because firstly, this has better spectrum of activity against certain agents which are very, very sensitive to the other agents, like higher temperatures. Firstly, for example, when we are talking about T's, we should also remember tubings. So certain agents or certain devices like electronic devices, certain tubings, they get destroyed or they are unable to withstand that high temperature. So all of these devices, they are sterilized by ETO machines, right? So these are the important chemical agents of disinfectants, the most important uses, the most important indications, and their working principles have been discussed in this particular section and this particular video. Thank you.